就一个致命一击，就以前都吃药，然后靠按摩，然后自从做了那一次就说拔河之后，就整个腰就已经非常难过，坐也不是，站也不是，睡觉也不是。
那之前有先去，就是有这个症状，有先去做其他的治疗，或者说怎么样吗？
有我就先去看了专科医生，然后专科医生那边就帮我先让我吃药，那吃药没有效，后来就做复健也没有效，然后医生讲说那要打针，那我后来想到打针我就怕，因为打针有很多副作用，后来我就去找针灸，找推拿，甚至就说中国什么贴膏药什么的都没有用，试了很多个月，然后刚好最后有一次是我太太在电视上看到就林医师的广告，所以我就过来了。
所以现在这样子的这个治疗对你来讲效果如何？
效果非常的好，我是觉得说前几个5-6个医生加起来都不及他的1/3或是1/4好。
但是其实就做这个机器已经是让你非常的很好了。
我是觉得说非常的神。
这个是。
因为我这个毛病已经非常多年了都是说过去的时候都是就说吃药啦，或者是就说没有好过，但是就说稍微说做一点粗重的活之后，就觉得可以就说躺在床上躺个1-2个礼拜。但是就说在林医师这边做完之后，我是觉得说我是可以做，但是算还就说林医师也是叫我说自己要小心一点。但我是觉得说我已经渐渐可以做这些活，做这些就是比较粗重的院子的活啦，或搬一些东西，但是就说不会觉得说腰会酸痛，所以我自己感觉到说好像跟以前不一样了。
那你在你这个做的过程是非常舒服的吗？还是会有痛？
痛是绝对不会痛，只是感觉上好像整个人会松弛，就说因为你压了那骨头，就说脊椎间盘突出会让你压着那种感，但是就说在拉的时候就让你好像把你放松。有时候我躺在这边基本上都是在睡觉，真的很舒服。
脊椎开刀，
脊椎开刀
以后腰酸背痛。
那是怎么样发生？什么情形发生的呢？
脊椎那个软骨磨损不能通，所以才会痛，痛了受不了才会开刀。
那开刀以后觉得怎么样？
开刀以后就是这个腰酸背痛，就是腿越来越不能走路。
就开刀完以后反而越来越不好，对不对？
对。
所以您就后来才开完刀以后才做这个，
就是这个治疗。
那做了这个治疗以后，这个感觉怎么样？
感觉腰不酸，不痛，腰酸不痛。
所以说就是您觉得这个治疗可能还蛮有效的。
蛮有信心，我觉得。
蛮有信心，就是说这个治疗比这个开刀还好，就对了。
那当然。
是。
We have Cherry here with us today. She has been a patient of ours for the DRX 9000 spinal decompression. She's getting here to train the neck, and she was here because she has 4 discs on her neck that's bulging out, and that's the reason why she's here. So Cherry, can you tell us a little bit about your pain before you started treatment?
Well, when I first came in, my neck was always in some kind of pain unless I was lying down. I felt very stiff. I didn't want to move back and forth. Whenever I sat down or was in my car, it was very painful in my neck and my upper back.
Okay. Now, because of your neck, what is it that you cannot do? Or about your work, your house?
I basically didn't want to do anything that required me to bend over because it would put pressure on my neck. If I'm reading a book, I'd have to do this. It was very sore, and actually really limited my activities because I was afraid of making it worse.
What kind of activity that you really can't do before? Any specific ones?
Let's see. Well, even when I would go for a walk, it would irritate this too. It would start to hurt.
Okay.
So, I just really tried to limit, and it did hurt most of the time.
Most of the time.
But I was up and around.
I see.
Yeah.
Okay. Does the pain travel down to your hands at all or arms?
I haven't noticed anything specific.
Okay,
Yeah.
okay, I see. Now, so how many sessions that you've done on the DRX until you actually feeling better, feeling improvement?
I actually noticed after the first one.
First one, what kind of improvement do you feel after
I
the first
noticed that
session?
my neck was not as stiff,
Uh-huh.
that my posture was better. It was easier for me to correct my posture. I tend to want to stick my neck out.
Mm-hmm.
And it was much easier to maintain a better posture. Before, it was constantly having to check myself,
I see.
correct my posture.
I see. Okay, so after how many sessions? Let's say right now you are doing about 15 sessions, something like
I
that.
think so.
Okay, how are you feeling now?
A lot
compared to
better.
Before.
A lot better. Yeah, I have a
Okay.
lot more flexibility in my neck.
Uh-huh.
The pain is, minimal to, annoying, but it's not chronic. There's times when I don't have pain. Most of the time, I don't have any pain.
Mm-hmm.
If I overdo it, I'll get some pain in my neck, but it's much milder.
Mm-hmm.
You can even drive. The car used to be the worst thing, and even driving the car now is much better.
Okay.
It's significantly better.
Before you coming to us for treatment, did you visit any other doctor or physician?
Yeah, I had been to an orthopedic doctor. He did the MRI on my neck and sent me to physical therapy, and that relieved me of the pain.
Mm-hmm.
The only problem was that, even though if I kept the exercises up at home,
Yeah.
there were still things they did for me that I couldn't do for myself, like manipulation, of my neck and so on. And so I was constantly asking my husband to kind of like pull on my neck to relieve some of the symptoms.
Right.
And I also was living in this like anticipation it's going to get worse.
Oh.
Eventually, just by wear and tear, I knew it'd have to get worse in 20 years, 30
Right,
years.
right.
So I felt really worried about it. I was always aware of it.
Uh-huh.
So, when I found out about this, I thought, wow, this is actually going to decrease the actual problem, not just the symptom, not just the pain, but actually
Right.
give me back some of that, original state that I
Right.
had before.
Good, good.
So, yeah.
Wonderful.
Yeah.
So when you knew about the price you had to pay for the session, what was your reaction and why do you decide that this is for you?
Well, I was disappointed that insurance didn't pay for it because they'll pay for surgery, and this
Right.
is less expensive than surgery and less invasive,
Right.
and all that. But I figured, this is my my life. It's my, I can't think of the word, the quality of my life.
Okay.
And I felt like I had to restrict myself to so much. Just didn't want to bend over, didn't want to do so much, and constantly worried about it. I thought, well, this is a big difference in my life. I don't have to worry about hurting my neck so much over little things, making it worse, eventually having to have surgery. This will give me, a bigger time frame. Maybe in, who knows, in 30 years when I'm, 70 or something, maybe I'll I need something else, but at least I don't have to worry about it as much now, and a lot less pain.
That's good. That's awesome.
Yeah, and I forgot to mention the numbness that I would get in my face and the pains in my face. Those have
Right.
greatly reduced too.
Awesome.
Usually it's been gone unless I do something to irritate my neck, and it'll come back a little bit,
Uh-huh.
but not like before. And then after the treatment, it'll go away.
See,
So,
good, good.
yeah.
I think, did you ever mention about your hands?
The numbness in my hand,
Mm-hmm.
because of the operation and all that, I can't really tell if it's lessened or not. It's a
I
little hard to
see.
tell because
Okay.
it's just that, it was already done.
Right.
It might be a little bit less, but it's hard for me to say. I've been focused on my neck,
Of course.
and
Okay.
yeah.
Awesome.
我来治疗之前呢，因为我的腰是痛的不能弯，有时候呢就是说裤子都穿不了，要我太太代劳来帮我，所以早上起来刷牙的时候呢是不能弯腰的，只能蹲下来去刷牙这种状况。那么呢这种情况呢也延续了差不多有10年了。我也治过很多地方，去看过一些chiropractor doctor，我的 family doctor 也介绍我去看的医生，那医生都是说要么就是开刀， 要么就是只能吃一些止痛的药，比如说经常是晚上睡不着觉，就吃2粒3粒那个 Motrin， 这样来顶住。那么正好呢，有一天我是在报纸上